Okay, great. Hey, thanks very much for that. And Dr. Chopra, as usual, thanks for fascinating and impressive presentation. We hear many organizations talk about this patient-centric digital transformation, but you're one of the few organizations that I think have done it. So congratulations, and it's great to partner with you. You did
Thank you.
mention a couple of times, you've been practicing medicine now for 30 years or more, and I think you mentioned you started out charting on paper as I did when I first qualified. Um, but despite the frustrations that we all have with the EHR, I don't get a sense that any doctor really wants to go back to the dark ages of paper. They really like the transformation that you've started to talk about. So, given that data entry burden that EHRs have created, I certainly always felt that voice would be a more natural way and a more natural and efficient way to chart. So, I'd be really interested in your thoughts when you reflect on the different modes you've used to chart over the years, and you've used a lot, I'm sure. How do you feel that compares now with this new era of artificial intelligence with the Cara mobile assistant?
Yeah, what it has done for us, and I truly believe this in my heart that people feel before they think, and well-being. So one of the things I've always believed in is that no physician has ever healed any other human ever in the history of mankind. The body heals itself, and we know that people, when they feel good and their spirits are up, their immune system gets strong. So when I walk in a room, I want to give them my undivided attention. I want them to feel good, whether it's whatever contact we have with them, eye contact, human contact. And instead of looking at a computer screen all the time and trying to type it in, so that has been the very first thing that has made a huge difference. Then
Hmm.
obviously we tried scribes and people, but that's where the operational inefficiencies fell apart. Now to have something like this with the accuracy, it's recorded, and with the artificial intelligence actually learning and the deep learning, machine learning, learning my behavior and how it's going, it's really been powerful.
Hmm.
Things that I remember used to sit around for 10 days and I haven't finished this note and people are hounding me. Now it's done. Care
Yeah.
coordinators look at the note, everything is done, and it's moved on. So it's been very, very powerful, and I think this is just the beginning. I envision where I'm actually doing a procedure or surgery or whatever, and I'm just talking, whether it's in my ear or a microphone, saying, "Hey, I did this, I did that," and the system's picking it up. Right now, I have another human being writing all that. So there, it's a lot of power this to be unleashed here.
Yeah, right. And we've talked about that in the past as well, Romy. So I think that that's definitely in the near term for us together. Let me just ask Ryan whether he has a question he'd like to ask, and then I've got a couple of others as well. Ryan, over to you.
Sure. Dr. Chopra, appreciate your time again. And I remember you'd mentioned earlier in the talk about one of your staffers, and I believe a nurse practitioner that was over 100 charts behind. Uh, and I was curious if you could share a little bit about that story and what it took to adopt this technologies, especially for something as fundamental as charting.
Yeah, this actually is it's a remarkable story because this nurse practitioner of mine, she's had a lot of experience. She's very energetic, very passionate, truly patient centric. And we see patients at home, we see them in nursing homes, we see them in hospitals. So she was traveling everywhere doing all this, and there's information that's sitting in there, the EMR of the nursing home or the hospital, and there were all these patients. So she'd see them, and they're running around different places, and now she's behind, and she one feels terrible, but she has to catch up. Now you got to do it off memory or scribble notes, and I could see the burnout. And at the same token, our patients are not being taken care of, so the all the complaints from the referring physician, the patient's families that, hey, you were supposed to see them, you told us they're going to have a procedure, it's 5 weeks, what's happening? Everybody's upset. And oh, she was in my conference room, we were having a meeting, and she just exploded on me. She was like, just in tears, ready to quit. It was classic burnout. And it took me a while to calm her down. And I said, listen, I have the solution for you. I've tested it. And they all looked at me very skeptically. And I actually went with her to the nursing home, showed how I did it. And that time, we weren't even using the ambient mode. I was just would look at a chart. So I'm looking at the EMR in the nursing home, and there's all this information that earlier she would sit down and type. Instead, what I did now, I'm reading it. Here's the ICD-10 codes, here's the orders. I'm just talking away. We've since have modified it where we actually do pre-charting, which is we have a care coordinator or a care manager who will look at that notes online and just dictate it before. So when we go there, we dictate, hey, I just saw this patient, this is my examination, this is my assessment, this is my plan. Now she's 0 cases behind. Now that it has created a new challenge for us, which is a good one, is we've got more patients in the pipeline that she's bringing in, and now we got to make them work it. And that's on our digital transformation platform of, hey, I need to get this patient approved quicker. So we're looking at ways how to connect with the payer faster. Yet now we can click a button and see their insurance verification. We're trying to get the pre-authorization. But you see, if I cannot process my first clinic visit, how can I do everything else? And there's an entire ecosystem of people waiting for that information down the stream. So she said, yeah, I scribbled it somewhere in my notes, but nobody knew it. Now you just say it in Saykara. It shows up in the EMR. It shows up in our care coordination system. And now things are moving fast. And her satisfaction rate is through the roof. Her bonus is up through the roof. She tells me things like, Dr. Chopra, I'm not going anywhere. I just love it here. And she will tell you, I love Saykara. That's just the way she does it. So it's been fascinating to watch that.
Well, we love to hear that, Dr. Chopra as well. So actually, it's an interesting point you raise, which is that different practitioners, different physicians, different practitioners, have different styles. And so one of the things, obviously, that we thought from day one was that we built Saykara on a foundation of artificial intelligence. And that really means that it learns more and more based upon each encounter and each user's personal style and preferences over time, so that each new patient you see adds to that knowledge base. Have you and your staff found that Saykara has adapted to you as much as you've adapted to it? How has it been, and has it been effective at learning the different documentation styles for the folks who are using it in your organization?
Yes, and it also depends on, one is how people learn. Some people like to speak, some don't. Some like to see more, etc. So we're finding that everybody uses it slightly differently. But, the best one is the ambient mode where, I'm just talking to the patient, right? So, and that's picking it up. So that conversation goes in. And then at the end of it, I've got a little summary in my head of what I want to do. So I always start with the plan, because earlier I used to have to remember chief complaint, HPI, review systems, and it was torture. Seeing the patient was good, easy, fun. Now I got to do all this paperwork, and I hated it. And as much as passionate I am about information and data and kind of, I look at it where there's data, it's just pieces of data, of information. But then when you process it, becomes information. That information, once internalized, becomes knowledge. That knowledge, once you ask what you're going to do with it and why, becomes wisdom. So making this easy to get all this in helps us deal at a wise level. And we soon learned that there's one person who loves Saykara, but he still likes to go back in and type a little bit. Then there's one who loves the ambient mode more. And it's their learning style that comes into play. I hope I answered your question.
Yeah, no, very, you really did. Yeah, no, thanks very much. And it's a journey, for all this, and the more data you get, the better it's gonna learn for you and adapt. Ryan, I'll bounce back to you.
Sure. Yeah. I have a question for you, Dr. Chopra. I know that quality and completeness of the node is real critical for your practice, and with the high volume nature of your organization, that's always a challenge for any practitioner to capture all the salient, relevant clinical information. What did that look like after embracing and deploying the Kara mobile AI systems? as to compared to your previous work documentation workflow?
Yeah, one of the key things that happened was earlier when you had to type and you had to 5 million people pulling you in different directions. There's so many things to be done. We started to get, less and less accurate and less detailed, and just try to put the same thing in there. Versus when we use something like this, one is in the mode that you are. If it's in the ambient mode, the system listens to everything and puts it in there. You can always edit it, and so it's better to have more and cut it down than to have you can't put more. And then also, one of the things we've done is we've started to create for our own selves, because everybody thinks differently, a little template of what I think needs to be there. So I just sometimes look at it on my phone and I know I'm going to fill all this in. But within a few minutes, I've got so much more information that I need, and it's in the system. So that's really what it has done for us and helped us.
Yeah, no, that's good to hear. And the other thing that you mentioned as well, Dr. Chopra, was that as MIMIT expands, you're seeing patients in multiple different care settings, but also you described some people prefer to use it directly in front of the patient, some outside of the room, maybe some even on the way home or between cases. How important has it been for you that Saykara is actually mobile and then it just fits on your phone, and so you can use it anywhere?
Oh, so I'll give you a real scenario. With the COVID thing happening and everything else, and the CEO of one of the nursing facilities called me and said his godfather, very accomplished gentleman, he was playing golf with him, and he said, I think he has PAD. And he tells him, I know who's going to see him. So he calls me. I got a message saying, got to see him. And that gentleman is nervous to come to our office. So first we said we'll do telehealth, but he had already been tested negative. I'm tested negative. So I said, guess what? I'm coming to your home. So we did a home visit. I go to his home, examine him, we do everything else. And now I got to do this note. Now I know by the time I get to the office, I'm going to forget half of this stuff. They're going to drown me with other stuff. As I got out of the car, I pulled out my Saykara and my iPhone, pulled up the app, and I'm talking away. By the time I got to the office, everything was done. I had already dictated in the assessment and plan all my action item care plans. And, I talked to him as if I'm talking to it's an assistant. So I talked to him and say, you know what, I need to call this patient. I need to call so-and-so. I'm just talking naturally like I'm talking to somebody else. And we also tested this app where I would kind of dual record it, one on Saykara, and then one on, we use another recording software. We've obviously stopped doing that. Now we just put it in there, and that care plan part that I dictate goes into the EMR, where it says plan. That EMR then shows up in our Health Cloud software in Salesforce, and that is actually an action item for the care coordinator to assign the task to all the different people. So by the time I got back, all the tasks were already assigned to the right people to get this thing done. So that's the power of mobile.
Yeah, no, that's great. We hear that a lot, actually. I do have another question, but Ryan, do you have anything else you'd like to ask Dr. Chopra?
Yeah, well, I wanted to ask Dr. Chopra just one more thing. We as we brought Cara to the market over the last few years, we find that the motivation and interest from physician to physician and group to group really varies. Anything obviously from productivity, throughput, physician burnout, of course, and AR and increased coding capture in some instances. So I was curious what your thoughts were here. What was the primary motivation for MIMIT, and where have you seen the greatest benefit?
Hey, for us, the first thing was to get that note completed, get connected with the patient, and move that. That was the first part in the front. But we're realizing now that the more we use it, the more it's getting embedded, that we are expanding into the other aspects of it. Like, for example, we give it all to our coders right now anyway. So for me, it makes sense to have the information up front better. So I've increased the volume of patients I see. I have care coordinators. I'll just walk into a room. I'm doing all this. It's recorded. They show up. I'm going to the next patient. I've said everything I need to do as if I'm telling somebody. And then it shows up in the plan. I'm going to the next patient already. And then I've relied on my system behind to look at the note, make sure everything's set. When it's ready, it shows up in my queue to sign it in my EMR. When I sign it, it shows up right in our health cloud as well. So we've automated that process. So to me, that's the biggest aspect with Saykara. Now, somebody, if they don't have that system, they may use some of the other aspects. But for us, this has been the biggest thing.
Yeah. No, that's good. And as you say, it's interesting as we see different organizations. Some of them are focused on revenue capture. Some of them are focused just purely on resolving burnout. But I think you've talked about a sort of a holistic approach there. And I think anyone who was listening to the presentation, just would find it difficult to really get their arms around what needs to happen to make all of this come together. Obviously, you've invested a lot of time and energy in this digitalization, not just with our solution, not just with Kara, but with Salesforce, MedStreaming, so many others, patient engagement tools. And obviously that doesn't happen overnight. It's a years-long journey, and it's an ongoing journey. But for those who are listening in, could you offer advice to them on how best to get started? If it's other medical practices looking to emulate what you've done, and how you might step in over time.
Yeah, I think the first is that the key stakeholders in an organization want to know, hey, this is what we want to do, and you're centered on the right thing. I want to be patient-centered, and this doesn't, you have to have the grind on this. You have to say it's not going to be instant. It's not that we're going to put this and all of a sudden I'm going to have massive outcomes tomorrow. The second thing I would say is you got to think in terms of platforms, not just siloed software. It's got to interconnect, and it's the agile methodology, one step at a time. And we use this methodology called VPIC: visualize, plan, implement, close. I'm a huge fan of the Stephen Covey organization, and that's the project management kind of methodology. So you have an idea, you say, where is it that we really want to go? And then from there, start planning it and go stepwise, and then start implementing phase by phase and get it with an end in mind. Begin with the end in mind. Yeah. And the one thing I would say is the Nobel Prize here is that patients love you. They won't go anywhere else. Mm-hmm. I mean, there are conditions I don't treat at all. We don't treat, and we'll get requests. And then we've started to actually build out a ecosystem of physicians where we've started referring out to people, and they've started to get to know us more. But you can't do that in isolation. That's where you got to think of, don't buy just one software, but think of a platform of some kind. For me, that was Salesforce. But when I say Salesforce, not just the CRM, but it was the underlying technology and working. I can talk about this for hours, but I just that's how I'm to this.
I'm sure you can. It's there's a whole art to this as well as the science, and so thank you very much, Dr. Chopra. That's excellent. I think there are a number of questions that are piling up from the audience, so I'll stop now. Thank you for your time, and then we'll hand back to some of the questions that have come in from the audience.
Yeah, thank you, Dr. Hughes. To those of you in our audience, there is still time to submit questions. Again, all you need to do is go to the Q&A tab at the left of your screen and enter it just like you would a text message on your phone. I'm going to start with a question for you, Dr. Chopra. As you've reduced the burden of documentation on providers, what changes have you seen in how those providers use their time, both in terms of their focus in the exam room and their clinical decision-making outside of the exam room?
Yeah, one of the things we say is that we put the care back in healthcare. And if you're unhappy, you can't be kind and caring. So one of the first things we've seen is with the burnout going down, that the providers are a lot more calm and less stressed out about all that stuff. But they've spent more of their time actually being more productive. So you can see more patients, but you're also doing it happily, and you're actually being more effective, which also has meant that now you see more patients, your volume's going up, revenues go up, et cetera, et cetera. So it's been a good cumulative growth effect. I hope that answers that question.
All right, Ryan, let's go to you with a question. Does Saykara automate SOAP processes?
Yeah, the primary work effort that our AI assistant is delivering is to synthesize a highly accurate and meaningful SOAP note. And so we do follow the SOAP documentation methodology, but we also do support other methodologies such as APSO and problem-oriented charting as well. Hopefully, I'm answering that question. But those are ways we look at that workflow. And in addition to that, Sarah does perform other high-value tasks, such as orders like medications, diagnostic tests, as well as blood lab work. So you can use Sarah both to facilitate the subjective narrative in the SOAP node, as well as commands such as orders. And we are also rolling out the ability to be able to retrieve information from the EMR as well that could be very relevant at the point of care.
Okay, Dr. Chopra, another question for you. Do you have somebody who just does reports and analytics? What are your most valuable KPIs or dashboards?
Oh, I have a whole team. So we have Director of Digital Solutions and Systems. He's passionate about analytics. He'll repeat everything I'm saying here today, and even if you wake him up at 2 in the morning. But what we've done is the key performance indicators change at the level. So at the board level, at the executive level, at the manager level. So our mantra is to give the right information to the right person at the right time to make the right decisions, and obviously for the right rewards. So we have dashboards for our care coordinators, which patients have been seen, how long has suddenly not been touched. For people who manage the teams, how many people logged in, when did they log in, et cetera, et cetera. So there's a dashboard on clinical, operational, counting, et cetera, at different levels. So we do that. And this obviously doesn't come easy. It's hard work, but that's what it takes. And we've slowly and steadily developed this, where even though we are a small organization, I've invested heavily that we can be hyper scalable, and we have now built up a development team behind this. Even there, we apply the same methodology. You do it better, you do it faster, and you do it cheaper. And we use the agile methodology to do that.
All right, Dr. Chopra, we have another question for you. How have you advanced communication between doctor care team and patient/customer?
You're going to love this one. So what we've actually done is, again, we use Salesforce, the technology, as a platform. So the first thing that we actually do is we track something called the household, which means any human being that has come in touch with that patient, we track them, whether it's a nurse, a tech, a physician, referring physician, family member, power attorney, whatever that may be. Then the other thing we've done is, there are so many systems out there, and we've integrated voice, we've integrated chat, whether that's all HIPAA compliant, by the way, where we've set that up and it connects into our platform. So a patient can call us, can text us, and then we also have referring physicians on our communication platform. We also have vendors on a communication platform. There are vendors who will come in to support complex cases, and they are involved in the care plan. They will, right from my mobile device, we use Salesforce Chatter. So basically, I can chatter. I saw a patient this morning. I came out. I was already talking to Saykara, and right there, within 30 seconds, sent a chatter note to the referring physician, and he already responded, and it's linked to the patient's name. So that's the hyper connectivity, and it's what you do in real life, right? You want to talk to somebody, you text them. Now, if Amazon, whether they will tell you, oh, by the way, you're tracking your package, look at the map, it's 8 stops away. Why can't we do that for healthcare? So now we've started to do that for healthcare more and more. We've started looking at, we look at how our providers go to different patient sites. We have multiple sites in the city. Just like you have field service folks, there are technologies and solutions out there you can apply to kind of solve those solutions. The same way we made sure that connecting voice, that means a call, messaging, email, but also we do DocuSign and we'll share via Box for Healthcare, which is HIPAA compliant, all integrated together. So we have patients around the world actually that will be dropping files in there and they're updating this. That's the kind of connectivity we got. I hope I didn't go too far, too deep, too much, but that's what I'm passionate about.
That's terrific. All right, Dr. Hughes, I'm going to combine a couple of questions. So this is a twofer. Does Saykara work for all specialties? And how does it figure out how to read between the lines of a physician's shorthand?
Yeah, that's a great question. The first one is easy to answer. Yeah, we're specialty agnostic. Essentially, because it's AI, we learn from previous notes, from looking at patterns that we see in charting from before. So we use that to bootstrap, and then as we go along, we learn more and more and more. So each specialty is an opportunity for us. We're not hard coded like other systems might have been to focus only on a particular specialty. So we're currently live in over 16 different specialties, and we'll take any additional ones on as well as they come along. In terms of reading between the lines, that's also one of the things that we start out doing, which is, as we understand what a physician says or that any of the caregivers are saying as they're interacting with the patient, what we also know is how do they like that to look in terms of the final output of the note. So what we end up doing is interpreting the conversation or interpreting what the physician is saying, and that then gets translated into the actual note as well as the information that gets entered into the EHR. So essentially, we're learning and bridging some of those things that are both spoken as well as between the lines, essentially. And so just as Dr. Chopra had said, you don't have to speak literally here. You just have to speak in a conversational, clinical manner with the patient, and we will fill in, the intent, so to speak. So yeah, it's a great question. If that person has any follow-up questions, love to connect with you online.
All right, Dr. Chopra, I have a combination compliment and question. So we start out with great presentation and amazing outcomes, exclamation point. Thank you for sharing. Can you talk about the biggest challenge you experienced when integrating the technology and how you overcame it?
You'll find solutions on most of the ones, but the biggest one is change management. It's changing people's mindsets is the biggest challenge. If you're short on capital, you'll find it. Once you find the right software, you'll find somebody to do all that for you. But even after having all that, if you cannot get the adoption and the way to change, especially of the way of thinking, I remember initially as I was doing this, one of the providers walked in my room and said, "You know how much all this costs? Why are you doing all this? Why do we need all these things? Just write the note, we do the cases anyway." But I knew that to hyperscale, to break to the next level, now he's one of the biggest fans, of how we've been able to do this. So that, I think, is the biggest challenge. The rest of it, you'll get the capital, you'll get the technology, you'll get the people. That's all very easily doable if you have the ambition and the desire to do it. But change management, and today it's still one of our biggest challenges. How do I train everybody effectively in a scalable manner to adopt and use all of these? Once they taste it, they love it. But that first part is the toughest one. I hope that made sense.
Okay, we're going to get to our final question. Ryan, this is on you. And just to the audience, if we didn't get to your question, we'll be sure to follow up with you by email as soon as possible after the webinar is over. Ryan, you're going to have to talk fast, but we're going to ask one last question. If I want to get Saykara implemented at my health system, where should I start?
Okay, well, certainly first just reach out to us directly, and we will set up a web session to assess your needs, clinical needs in detail. We'll provide a custom live demo, and above and beyond that, from a system standpoint, we do work with several large health systems around the country on multiple different EMRs, including Epic, Cerner, Allscripts, and others. And we would work together to develop a limited rollout, if you will. We do offer kind of a trial pilot period for any system to use it at no cost for a period of time, and would work on a deployment to do that in that case. And so that process is usually about 4 to 6 weeks from end to end to do so. And so we do have an enterprise class platform to support any system of any size, and certainly the infrastructure in-house to onboard a wide variety of different provider specialties throughout the enterprise at any location from that perspective. It's really location agnostic. And so those are the key steps. So just say, reach out to us. We'll set up, this is highly personalized by physician or provider. And so we certainly want to customize it based on your specific clinical needs.